Hey, I'm Andrea Marcellus, and I'm here to give you a few tips to help you relieve lower back pain and pain in your hip. Like you and millions of people, I occasionally have lower back pain. I have small children that I'm picking up all the time. Sometimes I demonstrate things for clients and I'm not warmed up, which is never a good idea, and I'm all like, So one of the muscles that is often involved in lower back pain, but that we don't necessarily think about because the referred pain pattern goes down to your hip, so you think it's just your hip. But it's really a small muscle group called the Quadratus Lumborum. And I'm going to show you where that is and show you how to release it. So this is in no way a substitute for medical advice. Definitely if you have an acute injury, see your doctor. But if you kind of have chronic pains or you're just feeling a little something or your hip just won't seem to let go, here's something you can do and give yourself some quick release. So the first thing is to identify the muscle. Your Quadratus Lumborum is kind of hidden underneath your erector spinae muscles. So if you feel your spine and you feel these ropey kind of muscles between the bottom rib and the top of your pelvis, those are your spinal erector muscles. And then right inside of that and underneath it, halfway underneath it, but on the outside you can feel here your QL. And if you push from that bottom rib sort of in and up, you'll really feel it. And it's often very tender at that insertion point. The muscle, just kind of work it and rub down, and you can feel as you go down and you're pushing in towards your spine, you can really feel some tender spots and release that and go all the way down to your pelvis. It's helpful if you're lying on the floor, and then you can do this with a ball, or you could have somebody, if you can identify the spot carefully, pushing in towards your spine, find it and release it for you. You will often feel a radiating sensation all the way down to your hip, maybe down your leg, as you release this muscle, and you'll feel it down here. Now the other spot to release is across the medial glute. So that's your big gluteus maximus is here, and it goes across your body like that. Think of it, there are 3 trigger points. One, pretty close in on that pelvic bone, you can feel it right here in the middle. You don't want to hit your sciatic nerve, but it's right around there. And then on the outside of the hip, 3 tender spots. So if you work this QL muscle, and then you go and you press and work that there in the center and then across, you should actually be really able to relieve a lot of lower back and nagging hip pain. After that, if you want to give yourself a little active stretch, I prefer, rather than sitting here static stretch, to take something active like pulling your body forward and then rounding the back, so it would look like this from the side, pulling forward and rounding back. That will help release this gently. Then take your leg across, do a little twist, breathe, that's your inhale, exhale, release. Do it again, you're pressing your hand into your knee, you're lifting up and away with your spine, and then release, and then one more time. That's your inhale, hold, make your spine taller, deepen the abdominals, and then exhale, release. You would switch to the other side. Those 2 things, that manual trigger point release, and then the active stretching technique, not just holding there. You never want to overstretch. You just want to feel sensation and then let it go. If you feel like, oh, I'm stretching, that's too much. You're probably causing a tear, and then you're going to keep the problem going on and on and on. Okay, so let me know how that works for you. It works for my clients really, really well, and it works for me.